We've heard a lot of stuff this morning that makes it seem like pretty much a downer this morning. All the things that are wrong, all the things that you're all doing wrong, leading to the higher risk for heart disease. And some of what I'll talk about hopefully is things we can do to improve that. Heart attack means there's a blockage in that artery which stops the flow of blood to part of the heart muscle. A cardiac arrest is the term we use to describe a sudden electrical problem in the heart that causes it to stop beating properly. So we would say arrhythmia for something that's not in the right rhythm. Heart failure you've heard mentioned as well. It's a weakness of the heart muscle or the inability of that heart to pump the blood to the body organs as it's needed. So the heart's not able to, ultimately the heart is not able to do the job it was meant to do. You've heard us talk about angina. Angina is our description of what we believe is chest pain coming from the heart. But we as the doctors, when we give it the term angina or angina, that means we're pretty convinced that it's probably related to a blood supply problem to the heart muscle. Crushing chest pain, we've all seen that. Well, that's not always the case, as you've heard so far this morning. It's not always that sudden, intense pain. It can begin with vague symptoms. They may start slowly. The symptoms can come and go, and again, they're not the same for everybody, but they are a signal of some underlying problem that we should look into. So what can you do? Well, you can chew an aspirin if you believe this is the heart pain at home, and then of course, make sure you get attention from the medical community right away. What are the things we can do in terms of medications? I'm going to skip down to the one called Plavix. You've probably seen the commercials for Plavix. And what that is, in a general term, is a super aspirin. Here's that cath lab that we keep talking about. You have a camera that has a component above and below the table. So it swings around and can take pictures at multiple different angles to allow us to see all those arteries and the artery branches. These are those different catheter instruments and the stents that we use in the cath lab. Now the stents are metal, but they're this flexible metal, so it can bend in shape according to the artery that has a blockage. So what are some instructions that you can do? Managing medications is extremely important. It's best if you can have a list with you at all times. You never know when you're going to end up at the emergency room. Take the same time every day. Get in a habit, get in a pattern, get in a regimen. And don't skip doses without talking to your doctor. It's good to have an extra days pill with you at all times. We tell people in general, if they're having to watch sodium because of high blood pressure or congestive heart failure, to try to keep it less than 2,000 milligrams total in a day or in a 24-hour period. And always, as always, please ask us. We're here to help. We're here to give you some advice to help you live that healthy life.